population.
Sorry.
Okay, next slide.
Okay.
Okay, so what is a primary care provider? So a primary care provider can be a physician, which can be an MD or a DO, a nurse practitioner, a clinical nurse specialist, or a physician assistant as allowed by the state law, who provides, coordinates, and helps a patient with access a range of healthcare services. So typically your primary care provider should help facilitate health promotion, disease prevention, health maintenance, counseling, patient education, and then diagnosis and treatment of acute and chronic illnesses in a different variety of healthcare settings. So that may be in the hospital setting, that may be in a clinic, that may be in a comprehensive center as well. And then essentially a primary care provider should be, can you go back just one?
Sorry.
It's okay. A primary care provider should be a member of the patient's healthcare team that willingly works with other members of the healthcare team to promote care continuity across the lifespan. Next slide, sorry. So why is primary care important? Coming from being a warrior mom, I know that it is definitely hard to trust a provider outside of your hematologist. More often than not, our hematology professionals are the most knowledgeable of sickle cell disease and how it affects us, but a primary care provider can also be an ally in your healthcare. So primary care is essential to help individual. I think you're trying to rush me, Carl.
It's just sensitive. Sorry.
Okay. A primary care provider, primary care in general, is essential to help individuals navigate to good or improved health and stay healthy. It is also essential to help avoid preventable diseases by identifying risk factors early on. Primary care can also aid in coordinating and managing chronic disease care and longevity, which can lead to a better quality of life. And it also helps to promote care continuity. And what I mean by that is sometimes when you don't have a primary care provider who you can call and say, hey, I'm having this pain, or hey, I'm having drainage from my eye, that you have a lot of gaps within your care. But if you have a trusted primary care provider, they can take care of all of those things, and then you just have a centralized location for your healthcare. Next slide, please. So what is the role of primary care in sickle cell disease? As previously mentioned, and I know we kind of hear the pathophys of sickle cell disease over and over, but I just wanted to give like a general synopsis. So sickle cell disease is the hereditary group of disorders in which a mutation in the genes causes our red blood cells to become distorted. So with that distorted shape, you can have potential blockages within the veins or the arteries, or basically wherever blood flows. So unfortunately, due to the pathophys of sickle cell disease, you can have these things listed here, such as acute or chronic pain, stroke, cardiac issues, issues with the eyes, issues with the kidneys, issues with your lungs, or a vascular necrosis. I said all of that to just simply say that sickle cell disease is a very complex disease process, and it requires multiple healthcare providers coming from different angles to help manage one's healthcare across the lifespan. So essentially what primary care can do is help to navigate the patients to the different specialists that are required, and kind of be like a medical home to house all of the records and keep the continuity steady within the healthcare plan. Next slide, please. So primary care clinics, they should serve as a medical home, which help to facilitate partnerships between patients, clinicians, medical and nursing staff, as well as families. An optimal primary care clinic would provide care coordination services. And during this process, they should be identifying barriers that will impede to healthcare adherence. And I strongly emphasize this because it's easy as a healthcare provider coming from my arena to label a patient as being non-compliant or non-adherent, but the provider hasn't taken the time to identify the barriers as to why they are non-adherent. I don't even like using the term non-compliant. So a good healthcare or primary care provider will also provide resources and support that will assist in the adherence to that care plan that they're prescribing. And having a good healthcare provider or clinic that you visit can also reduce the fragments in your care. So a primary care provider should be able to provide appropriate referrals to the specialist. And With a lot of the insurance companies, you can't get those referrals for specific testing or providers such as a lung specialist or eye specialist without the primary care provider being the one to write that referral. So primary care providers are also important in that regard. A primary care provider also collaborates with other members of the healthcare team to create that holistic approach. We also fight with, I put work with, but it's more like fight with insurance companies to get authorizations and approvals for different testing, medications, and procedures. Next slide, please. So this, I just wanted to illustrate that the most important person in the healthcare plan or the care plan is the patient. So all of these resources, all of the things that we think you need, or all of the medication or support services or resources that your provider, whether it's your primary care provider or your hematologist, is suggesting that you have, it should always center around the patient and their caregiver or their family. Always, always the patient should be the center of their care plan and the most important person in their care plan. Next slide, please. So some barriers to primary care include transportation issues, office hours of traditional clinics. Some people have the inability to take the time off of work. They have the inability to miss school, or in fact, sometimes the pain is just so bad they can't leave home. There is a shortage of primary care providers that are willing to take on the complexity of a sickle cell patient, and there are also a lack of informed providers. So moving to the next slide, I'll discuss how we can correct the issue with the lack of informed providers. So when you think about having an informed primary care provider, they should be familiar with the pathophysiology at bare minimum of sickle cell disease. They should be aware of the different diagnostic evaluations such as imaging or blood work or different procedures that a sickle cell disease patient may undergo or need. They should be up to date with the current standard of care based on the evidence-based practice that's within the literature. They should also be familiar with new treatment options, whether it's medical management, non-medical management, or alternative modalities that are commonly used across the sickle cell disease patient population. And then they should also be familiar with clinical research advances. Next slide, please. So we know that for primary care providers, them not being informed is still no excuse. They have multiple resources that they can actually utilize to help inform how they care for our sickle cell disease patients. So I decided to put a couple of these resources within the PowerPoint, because if you're already dealing with a primary care provider and they don't seem to be very knowledgeable about the disease process in itself, they have resources out there that they can review, that they can look up, and that they can get their hands on to become more familiar with the sickle cell disease process, how it manifests, and what the complications and morbidities may look like. So the National Heart and Lung Institute, sorry guys, health, and that cleared off, give me one second, sorry. The National Heart and Lung Blood Institute provided a framework that can assist providers in medical decision-making for the sickle cell disease patient population. So essentially what they did is gathered multiple experts from different areas. And if there was not a guideline present for a particular area when it came to caring for patients with sickle cell disease, they created recommendations that other healthcare providers could follow. So the guidelines were intended to assist health professionals with the management of both common issues and adverse events that may occur when you're caring for a patient with sickle cell disease. The areas of management included, but are not limited to, like healthcare maintenance screening. That includes things like immunizations, different screenings such as transcranial Dopplers, echocardiograms, and things like that throughout the years and lifespan of a sickle cell disease patient. It also gave them guidelines and recommendations on how to manage chronic complications, acute complications, as well as managing patients that may be on chronic blood transfusion therapy, as well as patients that are currently on hydroxyurea. So the target audience for these guidelines was primary and secondary providers who manage patients with sickle cell disease, both children and adults. Next slide, please. So this, you probably cannot see a very good picture of it, but I included this because the expert panel itself is over 100 pages long, but throughout that expert panel, they have snapshots like this where they could utilize quick references. If they have a patient that has sickle cell disease, it will show them exactly what to do and what the recommendations are as far as taking care of the patients. So they don't have to read through the full, booklet of the expert panel, because these summaries and snapshots are included throughout there. So they can just kind of look at the table of contents, look at what they're looking for, and flip to summaries such as you see right there. Next slide, please. So other resources that I have personally taken advantage of that I found to be extremely helpful is the ECHO monthly telementoring session. So every month they have case presentations where they present different scenarios regarding sickle cell patients, but it also allows the provider, like if they have a sickle cell patient and they're having issues, maybe trying to understand how to move forward or how to adequately care for that patient, they allow providers to present case presentations and get feedback from specialists such as hematologists, psychotherapists, and things of that nature that would actually help them manage their patient. So there is a general one that is held every first Wednesday of each month from 4 to 5 p.m. They can email that embraceSCD@atriumhealth.org and ask to be a part of the listserv. They do have to identify who they are, what type of provider they are, and what organization they represent. So because it's not kind of like a free for all, so they want to know who they're letting into these delicate case presentations. They're also out of Johns Hopkins, they have a similar one, but it's for advanced practice providers such as like nurse practitioners and physician's assistants. And this one is held every third Thursday of each month from 12 o'clock to 1 p.m. And the centers at jhmi.edu is the email that they would contact to become a part of that listserv. Another good resource is local and national community-based organizations. I think that this is a very underutilized resource that providers have not taken advantage of. Like with these organizations, you get to hear the patient and caregiver perspective. You kind of get to hear what are we missing from the healthcare provider component, because sometimes as a healthcare provider, we have tunnel vision. We see what the diagnosis is, we see how we need to treat that, but we may not see the psychosocial component of that, or we may not see how the decisions that we're making in the healthcare plan is actually affecting the patient or the caregiver. So being a part of these community-based organizations and kind of volunteering and kind of like showing up within the community can get them a lot more knowledge than they give credit to. And it also helps them to identify common gaps within the healthcare or things that they're completely missing. Another good resource for primary care providers is to just basically talk to other members of the patient's healthcare team. If I have a patient that has sickle cell disease and their primary person that they visit all the time is the hematologist, as a provider, I want to speak with the hematologist and I want to know, how do they manage this patient? Is there something that I can do on my end to help facilitate adequate management of the patient? And then most importantly, and I cannot stress this enough, patients and caregivers are the experts of their healthcare. They know their body, they know how things occur, and they know when something is not right. So they are the most important person to listen to. So I encourage primary care providers, or any provider for that matter, to listen to the patients and listen to their caregivers. Next slide. That would be my question slide. Is there any questions?
Please feel free to put our questions in the chat. I will be reading them out to our wonderful speaker.
Okay. I'm gonna stop moving my head like this. I believe that is it.
Thank you, Eboni. I have a question. You had mentioned, can you talk about the importance of comprehensive care? Because you spoke about, family practice, and we know that in pediatric world that a lot of times patients, parents tend to take their children to the hematologist, and sometimes I want to say the family, right, they have to be reminded back to the family practice. So we forget about that component of comprehensive care. Can you just stress about the importance of that?
So I will say comprehensive care is like the most important modality when you're dealing with any chronic illness, right? But especially when you're dealing with sickle cell disease, because of the pathophys of the disease process, it has the ability to evolve into multiple complications and multiple comorbidities. So when you have the comprehensive care, and I do know that there are some comprehensive sickle cell centers, there are some hematologists that will take on the hat of comprehensive care, but a lot of times, depending on where you go, it's comprehensive to a certain point, right? So it's comprehensive only at the pediatric level. And then when they get to the adult component, there is no comprehensive care anymore. So that's where the primary care provider, especially if they're like a family practice, where they can deal, like for me, I'm a family nurse practitioner. I can deal from 0 to 100 years old. So if I, as a primary care provider, if you have a steady person that can journey with you from the time that you're young till the time that you're old, they're a pivotal person to help advocate for that comprehensive care. So it's one thing to have the care at the hematology level and the pediatric component, and then to just kind of give handoff to the adult hematologist. But if you have like a family practice provider or a primary care provider who knows their patient inside and out because they've grown with them, they'll become another ally and say, hey, I know that this is what you prescribe for this patient, but based on me knowing them for the past 18 years, this is what works for them. This is the type of schedule that they need to stay on top of. This is how often I evaluate their labs. This is how often the previous hematologist evaluates the labs. So it's kind of good to have that primary care provider because you have an extra advocate and an extra ally to help facilitate that comprehensive care component. And then that primary care provider may have like good resources and referrals to adult providers that can take over that child's care as well. So I think, like I said, I am a strong person that at the pediatric level, I probably never took my child to a pediatrician separately. I always took her to the hematologist because that was someone who I trusted, someone who knew sickle cell disease, and it just seemed so much easier just to take her to the hematologist. But if you give the primary care provider an opportunity, give them some of the resources that I named, they can actually be an ally, and then they can, assist you into navigating through this brutal healthcare system. So comprehensive care, I can't even stress how important it is, because otherwise you're missing something. Like if you go from physician to physician, yes, you have them, but who's tying that gap? Like I can send you to the heart doctor, I can send you to the lung doctor, but yeah, you had a pulmonary function test over here, you had an echocardiogram over here. These two people are not talking to each other. But if I'm the primary care provider, I'm requesting records for both, and now I have that holistic picture on how to treat the patient.
Awesome, awesome. Are there any more questions? Okay. Well, you spoke about evidence-based management of sickle cell and the report that's actually out. And I just wanted to share that information is available publicly. So you can actually download the information and always have that on evidence-based management care. ASH had updated the guidelines. It was first put out by NIH. Yes. And so we definitely have the resources that are updated. It's good for caregivers as well as patients to understand what these evidence-based management guidelines are. If you're not health savvy, I tend to read health articles. That was my interest just for some reason, I was always interested in health. But just reading health articles and understanding them and better understanding them, you can, if you don't understand something, you can also take it to your physician. But I always say it's good to know, and good to know where the resources are. So thank you also for sharing that information with us. And definitely, you also gave us a lot of nuggets, which I thought was really awesome. You provided information that there are trainings available for our specialists and in the area of sickle cell and beyond. So there's a lot of trainings going on because, of course, sickle cell has many complications and components to it that, you know, physicians are always learning, healthcare providers are always learning in order to better help to manage the disease. And there's always some more evidence-based information coming in because there's always current research. So, and research is so important for our community. And also, as I'm on the topic of research, I want to tell those that are available that if you don't understand or pretty much would like to be a part of a clinical trial, always speak with your doctor to know what's available. And also the information is available to you that you can also do some research on clinical trials. But I am a big advocate for patients to get educated about clinical trials. It's that important. It's that important to us. We have a lot of clinical trials, and it's only going to help us get more evidence-based information out there to the public. And this is what helped us come so far along in treatments now of sickle cell. Imagine I'm just having one treatment for 20 years, and now we have 3 FDA-approved treatments after that. So we have 4 in all. So understanding that the progress has come very far, and it will come a further way with the advancements of treatments and clinical trials that's available. So definitely, I thank you so much, Eboni, for all this information and all those great nuggets that you pointed out to educate us about in making sure that we include the quality and treatment of family practice also into the medical practice into the care, because comprehensive care is a whole unit of physicians and healthcare providers taking care of our patients with chronic illness such as sickle cell disease and other blood disorders. So I thank you so much on this talk. As I was speaking, I just want to give, I just want to ask Denise, do we have any questions that came in the chat or Q&A?
There were no questions posted at this time.
Okay. Thank you so much, Eboni.
Thank you.
And I will look at that.
So I thought I took the slide out, but my daughter's name is Essence. She has hemoglobin SS, and she's my reason why that I pursued the primary care component as far as it comes to managing patients living with sickle cell disease. So that's my boo-boo.
Thank you so much for sharing. And we always have to remember that reason why we continue to advocate for those living with sickle cell. And as you know, I have a son that is now a teenager that's living with sickle cell. I have to say an adult teenager. I can't, trying to
it's hard to get it out, isn't it?
It's hard to get it out, but mommy's also transitioning now. So so I'm trying to get over that hump. So the continued care is our reason why that we continue to do what we do in the community. And we have to continue that reason why to know that we're helping patients and we're helping our own children and children of tomorrow. So thank you so much for joining this session. If you have any questions, you can always feel free to post it in the Q&A. We are here currently to enjoy the rest of the conference for the day. This is the time that you will get to enjoy exhibits, and also you can engage and just enjoy some lunch. Thank you so much for taking the time of joining our sickle cell and chronic pain management symposium. I appreciate every one of you. Thank you again for joining.
Thank you guys for listening.
And you were great, Eboni, I have to say. Thank you so much for your
Thank
presentation.
you. It was my pleasure. You know.
As always, as always.
Have a good one, guys.
Okay.